And so let's go ahead and take a look at the tibia and the fibula now. And we start with the tibial plateau. To the medial side, we get the medial condyle. To the lateral side, we get the lateral condyle. To the anterior surface, just inferior to the plateau, within the crownal region, we get the tibial tuberosity. This is the insertion point for the patella ligament or the patella tendon. We then see this kind of angulation of the points towards us here. This is actually the lateral edge or the interosseous attachment site for the tibia. This is the area for someone who happens to have a shin split issue, where we will start having pain along the length of the shaft of the tibia due to increased interosseal tension, due to inflammation within the interosseous membrane. On the inferior end of the tibia, we get the tibial or medial malleolus. On the fibula, we get the fibular head, or the head of the fibula. This is going to articulate with the tibia at the fibular notch within the plateau region. We then get the medial edge, or the interosseous attachment site on the fibula. When people have shin split, we usually don't get pain on the fibular side of it, mainly because the fibula is a non-weight bearing bone, whereas the tibia has a constant load due to it being a weight bearing bone. On the distal end of the fibula, we get the fibular or lateral malleolus. And so now we're going to look at the same two bones, but this time from a posterior aspect. So once again, we have the plateau region. To the medial side, we have the medial condyle. To the lateral side, we have the lateral condyle. This is the areas that's going to articulate with the medial and lateral condyle of the femur. And once again, the shape that we see here is going to be similar to the shape that we see on the femur itself. And in between the condyles, we will see the meniscal discs within the knee. We have that lateral or interosseous attachment edge. And then on the distal end, we have the tibial or medial malleolus. We have the head of the fibula, or the fibular head is going to articulate with the fibular notch on the tibia plateau itself. We get the medial or the interosseous attachment edge. And then we get the fibular or lateral malleolus. So the malleoli are going to form the medial and lateral aspect to the ankle. When we look at the ankle, it's made up of the tarsal and, to a certain extent, the proximal edges of the metatarsals, in which we have the talus, the calcaneus, the navicular, the medial cuneiform, the middle or intermediate cuneiform, and then on the calcaneus, we have a couple of attachment sites that we should be aware of. The calcaneal tuberosity. That's the attachment site for the calcaneal tendon, also referred to as the Achilles tendon. And then we have the hook of the calcaneus. The hook of the calcaneus is very important because that is one of the attachment sites for the long spring and plantar fascial ligaments, which is going to maintain the architecture of the foot. We have our metatarsals to the anterior side. In between the metatarsals and the hook of the calcaneus, we will find the arch of the foot. The arch of the foot is supported by the plantar fascia, which is a thick band of connective tissue that is going to ensure that the arch of the foot is maintained during loading and unloading as we have our gait or our walking. And so we're looking now at the foot and ankle again, but this time here we're looking from a dorsal point of view, in which we get the talus, the calcaneus, the navicular bone, our cuneiforms, our medial, middle, sometimes referred to as the intermediate, and then the lateral cuneiform. These are also numbered 1, 2, and 3. We then get the cuboid, We will then get to our metatarsals, our proximal phalanges, our middle phalanges, and then our distal phalanges. Just as what we saw with the carpal bones, the metacarpal bones, the metatarsal bones are going to be numbered 1 through 5, where Hollis is going to be 1 and Minimi will be number 5. We can see the calcaneal tuberosity on this dorsal view. And so now let's look at it from the plantar side. And so we can still see the talus. We can still see the calcaneus. We can still see the navicular. We can now see the medial and the middle or the intermediate cuneiforms. What we do not see is the lateral cuneiform. We can see the cuboid. We will see our metatarsals, our proximal phalange, middle phalange, and distal phalanges. And then we can see a couple things. We can see the remnants of the tuberosity, but more importantly, we can see the hooks. The hook of the calcaneus, and then the hook of the metatarsals. It's the hooks where we have the attachment sites for the plantar fascia that is going to hold the architecture of the arch in place when weight bearing, when standing on the foot. And we'll get more into that when we look at the actual articulations.